Mental illness is described by the Department of Health as a health problem that significantly affects how a person feels, thinks, behaves, and interacts with other people. Examples include depression, anxiety, and schizophrenia. This presentation will focus on mental illness in Australian males aged 18 to 24. Data from the Australian Bureau of Statistics National Health Survey 2014 to 15 reports that 11.1% of Australian adult males aged 18 to 24 have encountered high or very high psychological distress. Comparing this to the 6.5% figure recorded in 2007 to 8, we see a large increase in the incidence and prevalence of mental illness. For the year of 2014, the leading cause of death amongst individuals aged 15 to 44 was intentional self-harm. In addition, mental illness is one of Australia's 9 national health priority areas. Stigma can be described as a mark of disgrace, discredit, and unworthiness. Stigma is commonly associated with feelings of shame, despair, prejudice, and guilt, and often results in discrimination and ostracism. There are 2 types of stigma associated with mental illness: public stigma and self-stigma. Public stigma refers to the negative ways in which the general population react to people who are living with a mental illness, whereas self-stigma refers to negative self-beliefs that persons living with a mental illness hold and the associated impact on behaviour. Consequences of stigma include social isolation, the limitation of equitable opportunities for employment and recreation, and the discouragement of treatment seeking by those who need it. An Australia-wide phone-in survey conducted by SANE during Mental Health Week in October of 2000 found that Australians with mental illness said reducing stigma would improve their lives. In terms of mental illness in young adult men, stigma occurs at the physical, psychological, and social level. There is a preconceived notion that young adult males should be strong and manly, have thick skin and be able to deal with any kind of negativity in life, and should be social and have plenty of friends. In reality, this is quite narrow-minded thinking, as mental illness has been around for a long time, dating back to World War I, where many soldiers were diagnosed with post-traumatic stress disorder. Stigma is typically brought about by a lack of education and misunderstanding of the given subject. This lack of education and misunderstanding builds misconceptions, which propagates the whole process of stigmatization and often results in discrimination. To halt this, we need to focus on the positive exposure and education of mental illness in society. This can be carried out through mental health and illness programs, stressing that mental illness has a lot to do with physiological factors and isn't because somebody wants to think a certain way. Employment of these programs in educational institutions, medical clinics, workplaces, and community health centres would be ideal. Exposure of mental illness through the media in a more positive frame of light. Most media mentions of mental health associate mental illness with negatives. Encouraging influential leaders to tell their stories of living with mental illness to help others feel accepted and feel that they can reach out without being judged. Retraining of health professionals to improve their ability to assist and support an individual with mental illness. Encouraging help-seeking behaviours in men. Statistics show men are less likely to seek mental health treatment in comparison to females. This could be done by tailoring the age and gender of the health professional to what young adult males feel most comfortable around. Increased number of health professional initiatives that build public awareness of mental illness, such as what we see with Are You OK Day. And lastly, the continuous monitoring of mental illness and stigma. These methods of exposure and education work to break down any preconceived notions of mental illness and desensitize this health issue. And by doing this, we'll make more individuals comfortable in voicing mental health issues, whether it be theirs or somebody they know. Thank you for listening.